Animal welfare considerations are an essential part of animal husbandry programs and are extremely important to producers, customers, and the industry. The unrivaled 4-in-1 Tri-Solfen formulation provides pain relief, reduced bleeding, infection control, and wound care. Applying Tri-Solfen at castration may assist with a faster recovery of calves. Tri-Solfen's viscous liquid contains a unique combination of 4 ingredients: lignocaine is a local anaesthetic for immediate pain relief, bupivacaine is a long-acting anaesthetic, adrenaline to reduce bleeding, and cetrimide, an antiseptic agent to help reduce the risk of infection. When applied correctly with a dedicated Tri-Solfen applicator, it forms a foaming gel over the wound that helps to protect the wound from secondary infection and aids in the wound healing process. Key steps to achieving the best results with Tri-Solfen are: read the label and use the correct dose. Only use the Tri-Solfen applicator and castration nozzle. Pull the trigger firmly and quickly enough to generate blue foaming gel. Apply the product onto the complete area of the wound. The castration dose for calves under 100 kg is 6 ml, which is split into 3 2 ml doses that are applied into each vaginal tunic around the spermatic cord of each testis before the testis is removed, and the final 2 ml dose applied to the edge of the scrotal skin wounds. For larger calves, the dose is 9 ml per animal. To achieve this, set the Tri-Solfen applicator to 1.5 ml and apply 2 sprays for each application location. To adjust the dose, loosen the lock nut on the applicator. Screw the dose adjuster to align the front of the O-ring with the desired dose marking on the cylinder and retighten the lock nut. Step 1. Cut through the skin of the scrotum with a scalpel as per normal procedure. Make sure the incision through the scrotal wall and through the vaginal tunic, the thick fibrous capsule or inner bag surrounding the testicle, is long enough to allow the testicle to be easily squeezed through the incision and to allow good post-operative drainage. Step 2. Pull the testicle from the incision. Separate the blood vessels from the sperm duct and the fibrous tissue. Insert the nozzle of the applicator into the vaginal tunic and eject 1/3 of the total dose. Step 3. Remove testes as per usual procedure. It is advisable to pull the scrotum away from the body in one single stripping motion to allow the cut ends of the cords to retract high up into the scrotum and to remove any blood clots. This will reduce the chance of post-operative swelling and infection. Cut the cord using a scraping motion, as a clean cut will predispose to excessive bleeding. Repeat steps 1 to 3 on the other side of the scrotum to remove the second testes. Step 4. Apply final third of the dose to the edges of the scrotal skin incision. When applying Tri-Solfen topically to external wounds, always ensure that the applicator is squeezed hard enough to cause the product to froth and cause foaming. This will ensure that the product sticks to the wound and that the runoff from the application site is minimized.